All right, when we think about a pandemic, what's the first thing that comes to mind? The virus, right? We're trained to fear it. But what if I told you the real killer isn't the virus at all? What if it's something else, a silent accomplice that sneaks in right behind it? That's what we're digging into today, the hidden threat that almost nobody talks about.
So to really get our heads around this, we have to start with a question. And honestly, this one question kind of flips the whole script on how we've been taught to think about pandemics.
See, all our focus, all the news, all the public health messages, it's always on the virus itself, the initial infection. But when you actually look at the data, well, the data tells a very different story. It points to a much deadlier chain of events that happens after the virus gets in.
And that, menace, it's something called a secondary bacterial infection. The best way to think about it is like this. A virus, say like COVID-19, is the battering ram. It just smashes down the front door of your body's defenses, it weakens your immune system, messes up the lining of your lungs, and basically lays out a welcome mat for all sorts of opportunistic bacteria to come rushing in.
And this isn't some rare thing, not at all. A huge review, we're talking over 360,000 patients, found something pretty shocking. Nearly 1 in every 5 people hospitalized with COVID-19 ended up with one of these secondary bacterial infections. I mean, think about that. 1 in 5. That's a massive number.
And let me be clear, getting one of these secondary infections isn't just a minor complication. No, it's a game changer, and not in a good way. It's catastrophic. The data is just brutal. These patients are 3 times more likely to die and 4 times more likely to need a ventilator. Suddenly, the stakes are just exponentially higher.
Now, if that wasn't bad enough, this whole problem is being poured gasoline on by another massive global crisis. It's called antimicrobial resistance, or AMR for short. You've probably heard about it. It's basically when our best weapons, our antibiotics, just stop working. The germs, the bacteria, they literally evolve to become resistant to the drugs we designed to kill them.
And just to give you some scale here, in 2019, this is before the pandemic even hit, these drug-resistant superbugs directly killed 1.27 million people across the globe. That is a staggering number. It's more than HIV, AIDS, or malaria killed that same year. And we barely talk about it.
And the path we're on? Frankly, it's terrifying. All the antibiotic overuse during the pandemic just threw fuel on this fire. Now, experts are projecting that if we don't do something drastic, AMR could be causing 10 million deaths a year by 2050. Let that sink in. 10 million. That's more than cancer kills right now.
Okay, so how on earth do you even start to tackle a problem that huge? Well, it turns out the answer might just lie with one doctor. A doctor whose personal mission began decades ago, long before AMR was a term most of us had ever even heard.
Meet Dr. Katyali Srivatsa. This is a doctor who has spent more than 40 years right on the front lines of medicine. We're talking neonatal, pediatric intensive care, the most critical environments. And his whole career has really been this relentless quest to answer one single question. Why do our healthcare systems fail so often?
You know, working in those high-stakes units, he wasn't just looking at the patient in the bed. He saw the whole picture, the entire ecosystem. He watched how everyone from the parents and the porters to the nurses and the top hospital administrators all played a part. And as he started digging through patient records and reviewing decisions, he found this really disturbing pattern. Shockingly high rates of errors in both diagnosis and treatment.
And that experience lit a fire in him. This wasn't about getting famous or making a ton of money. Not at all. For him, it became a mission. A mission to fix a system that he saw firsthand was failing the very people it was built to protect. It was all about preventing infections and really empowering people against these systemic failures.
So, out of all this, his mission really solidified into a core philosophy. And it's one that, you'll see, pretty much challenges the entire foundation of how we think about modern medicine.
He calls this philosophy Maya. Now, in Sanskrit, the word Maya means illusion. And what's the illusion? According to Dr. Srivatsa, it's this blind faith we have that only doctors and hospitals can save us. It's a belief that makes us dependent on the system, and one that he argues can actually do more harm than good.
So what's the alternative? Well, the core idea here is a really fundamental shift in thinking. It's about moving away from this reactive model, where we just wait until we get sick and then run to the doctor. And instead, moving towards a proactive model,
where we, the patients, are empowered with the knowledge to help prevent illness in the first place. And believe me, the stakes here are unbelievably high. We're not talking about small mistakes. The data suggests that a huge number of deaths aren't even caused by the disease itself, but by these system failures. Get this, a full 20% of needless deaths come from just waiting too long to see a doctor, and another 13% from getting the diagnosis flat out wrong.
It all creates this vicious cycle, right? People panic and rush to the doctor for every little thing. That puts pressure on the system, which can lead to premature or unnecessary prescriptions for antibiotics. And that overprescription, well, it feeds directly into that massive AMR crisis we were just talking about, making our most crucial medicines completely useless when we really, really need them.
But here's the thing. Dr. Srivatsa didn't just stop at a philosophy. He wasn't just a thinker. He was a builder. He created a tool to turn all these ideas into action. A tool designed to put the power right back where he thought it belonged, in the hands of the patients.
That tool is called Dr. Maya. It's an AI-powered platform, and it works in this beautifully simple way. You just feel sick, you open it up, you enter your symptoms. The AI then crunches that information, comparing it against a massive medical database. And then, this is the cool part, it gives you this clear, color-coded guidance on what to do. Is this something you can manage at home? Should you see a pharmacist? Or is it time to go to the hospital? The whole idea is to stop that panicked, unnecessary rush to the clinic for every little sniffle.
So what's the result of this simple, empowering way of doing medical triage, sorting patients by how urgent their need is? The numbers are pretty incredible. An 85% reduction in diagnostic errors compared to the old school ways of doing things. I mean, that's just a gigantic leap forward. And all of this is built on a system that's been validated to have 98% accuracy in its AI diagnostics. It's just this incredibly powerful combination, right? You've got decades of a brilliant doctor's wisdom and experience all encoded into cutting-edge technology. And this brings us right back to where we started this whole conversation. It brings us full circle back to that tangled-up threat of a new pandemic and that silent, creeping pandemic of antimicrobial resistance. Because here's the ultimate connection. A tool like Dr. Maya, it's not just about helping one person figure out if their cough is serious. No, it's bigger than that. By changing millions of individual behaviors, by helping people avoid those unnecessary clinic visits, and stopping that flood of pointless antibiotic prescriptions, we can start to fight back, collectively, against these massive global threats.
Which really just leaves us with one final and pretty urgent question. The technology is here, the philosophy behind it is proven. So the real question isn't if we need a solution like this. The question is, how fast can we get it into the hands of everyone before the next pandemic or the full force of the AMR crisis finally hits?